Now we're going to be assessing your lower extremities.
Okay.
So I'm going to look for symmetry, and both legs are symmetrical. Also, I'm going to look at the skin color. It's nice and pink and warm all the way down to her lower extremities. And as I'm palpating, do you feel any tenderness?
No.
All right. So, and I'm also feeling the knees to see if there's any swelling in there. Checking her joints. I'm feeling the hip joints. Any tenderness?
No.
Okay. And I'm checking her ankles. I don't see any edema, nor do I feel any bulges or deformities on any of the joints so far. Looking at her toes. They are of normal shape and color. Good cap refill in both of her toes. And I'll have you place your feet back. And now we're going to check your range of motion.
Okay.
In your hips, which you'll have to stand for.
Okay.
And facing the camera, I will have you flex forward with your right foot and extend back. Good. And then I want you to abduct with your foot out and your leg. Good, away from your body. And I want you to cross your body. Good, which is adduction. And now be careful with the chair.
I'll use it for balance.
Okay. I want you to do the same thing with the opposite leg. I want you to flex forward with your left leg, extend back. Good hip extension, and away from your body, abduction, and cross your body with your leg is adduction. Good range of motion with your hips. Now, I'll have you sit back up on the chair, and I'm going to test the range of motion with your knees. If you can flex out.
This way?
Yes.
Okay.
Extend back. Good. And now I'm going to check your ankles. I want you to flex up, extend out, eversion away, inversion in. Very good. We're going to look at your toes. Spread your toes, abduction, and inward adduction with your toes only. Very good. And now we are going to test your strength. You can relax your legs. All right, so now with your hips, we're going to check your hips, and I'm going to have you raise your leg. Good. And raise your other leg. Good strength in your hips. And I'm going to go ahead and test your knees. Pressing your knees out. Good. Resistance.
Sorry.
And pull back. Good. And I'm testing your ankles. Pull back. And flex your feet up. That's for your ankles. And down. Very good. And now I'm going to test your reflexes with my mallet. We're going to be testing your patella reflex. And very good. And your other patella reflex in comparison. Very good. And that's a 2+ reflex there. And we're testing the Achilles tendon in the posterior.
You want to do it up just so the camera can see.
Yeah. Just so you can see, we'll bring the foot up posteriorly. And check the other one. Up. Very good. And now I'm going to test the Babinski reflex, which I'll bring her foot up from the posterior, from the heel to the great toe on the lateral aspect of the foot. And there's no Babinski reflex there. And the other foot from the heel to the lateral aspect to the toe. Very good. And it is negative, no Babinski reflex. Lastly, I'm going to test clonus, which is bending of the knee. So if you'll sit back a little bit.
Oh, sorry.
I'm going to bend your knee. I'm going to have you press against my hand. And now just relax. And I'm just feeling if she's pressing my hand away. And just relax, and there's no clonus there. I'm going to bend this knee. Don't press against my hand, actually.
Okay.
And I'm checking to see if her reflexes are pushing against my hand, and there is no clonus. So she's got good extremity strength and good color and no problems with her joints. And lastly, I'm going to check her popliteal pulses. And the other one, both are the same, palpable, 2+. And then I'm going to check her pedal pulses. This is dorsalis pedal pulse. And tibialis, posterior tibialis. And the dorsalis pedal pulse. And the posterior tibialis pulse as well. And that concludes the lower extremities.